I think it's an opportune time for us to revisit our Positive Space Initiative, which is really an initiative about trying to make sure that we are inclusive to all people of all backgrounds that can feel comfortable accessing us for services. We've recently done an evaluation of it, and our team is going to present some of the details of that evaluation, some of the next steps that we're going to be taking. So I'd like to introduce Jeanette Dimmer, who is our Manager of Health Equity, and Geneviève Projean, who is one of our health workers. Welcome.
Just want to remind everyone that it will be recorded and made available to the public through the organization's website. So welcome.
Hello, bonjour, Annie. As Dr. Hirji said, my name is Jeanette Demers. I use she, her, elle pronoun. I'm a registered social worker, and I'm presently the manager of our health equity team.
My name is Geneviève Projean. I use elle, she, and her pronoun, and I'm a public health nurse on the health equity team. This afternoon, it is our pleasure to orient you on the evolution of our Positive Space Initiative here at Public Health, and also share work underway to help reduce health disparities for members of the Two-Spirit, lesbian, gay, bisexual, trans, queer, asexual, and other gender and sexually diverse people. We will use the acronym 2SLGBTQIA+ when referring to this community during our presentation this afternoon. The Health Equity team falls under the Knowledge and Strategic Services division led by Renee St.
Welcome to Pride season. June marks the beginning of Pride season here in Sudbury and districts. Pride represents the persistent pursuit of dignity, rights, and visibility of 2SLGBTQIA+ people in our area and around the world. It's a celebration of resilience, acceptance, diversity, and inclusivity. The progressive Pride flag, which you find on your table, is a variation of traditional rainbow colors, along with added colors that incorporate design elements and representations of communities that have been underrepresented, notably Black and Indigenous folks, those who are intersex, and trans people. Public Health is pleased to stand with the community as we display Pride flags within each of our offices during this season. As public health professionals and community members, we have a responsibility to support inclusion for everyone and to stand up against hate and discrimination. We're committed to equity, diversity, and inclusion for our employees, for our clients, and for the community overall. In recent years, Public Health has explored ways to enhance policies and practices related to the 2SLGBTQIA+ community. Several key documents play a role in shaping and supporting health equity work that we do here. Health equity is a foundational standard of the Ontario Public Health Standards. Addressing the social determinants of health and reducing health inequities are fundamental to the work of public health here in our province. Engaging priority populations to consider the ways in which they experience health inequities is a key element of actioning this foundational standard. Another component that anchors our work is the 2024-2028 strategic plan, as referenced by Dr. Hirji. The strategic priority of equal opportunities for health helps us to work toward our vision of healthier communities for all. Due to experiencing disparities in health, this community has been identified as a priority population for public health. Health is shaped by multidimensional, overlapping factors that we call the social determinants of health. Gender identity and expression, as well as sexual orientation and attraction, are widely recognized as social determinants of health. Our different identities and life experiences can combine in ways that either give us more advantages for good health or lead to more barriers and unfair treatment. In terms of numbers, it's estimated that approximately 8,500 people in Sudbury and districts identify as 2SLGBTQIA+. According to Statistics Canada, here in Northern Ontario, 2SLGBTQIA+ people report poor mental health and social outcomes compared to the general population. This is further reflected by a nearly 3 times greater likelihood of experiencing chronic conditions such as anxiety disorders and mood disorders, as well as increased risk for suicide.
There's limited evidence about 2S LGBTQIA+ members and their lived realities, particularly for those in Sudbury districts. To address this local gap, we collaborated with Laurentian University in 2019 to conduct a study to understand their experiences and ultimately make recommendations for action. Using digital storytelling and focus group discussions, 13 stories were created, highlighting resilience in the face of lived experience of trauma and the need for inclusive, safe spaces and services. Key themes identified include, as highlighted on this slide, feelings of social isolation, need for safe spaces, experiences of violence, gaps in service delivery, and resilience and empowerment. Several recommendations came out of the study, such as amplify their voices, review and modify agency policies and practices, build capacity for safer spaces, share resources to increase inclusion and reduce stigma, enhance supports across a life course, promote improved mental health supports and services, and also create opportunities for social connection.
As an ongoing public health commitment to equity, diversity, and inclusion, and as per recommendations from the study, our agency has engaged in different efforts to support people from the 2S LGBTQIA+ community. As a starting point, public health implemented mandatory staff development training from Rainbow Health Ontario. Foundational training in inclusion and removing barriers is now part of the onboarding package for new staff. Reflection circles were also offered to our colleagues. These enabled discussions about how we could all incorporate our learnings into programs and services. Additionally, staff have had conversations about opportunities to modify their practice and reflect on their team's activities to advance this important work. Following consultations with subject matter experts at Rainbow Health Ontario, a plan was developed to address some of the ways public health could commit to creating an inclusive and respectful environment for all, and make an anti-discrimination statement explicit to everyone, getting us closer to becoming a positive space. To ensure we are providing a safe, inclusive, and positive environment for 2S LGBTQIA+ people, it was necessary to review and modify policies, procedures, and practices while making intentional efforts to ensure our physical environments were as inclusive as possible. The Positive Space Initiative was launched here at Public Health in June of 2023, and up until now, implementation of key measures to advance our commitment to being a positive space include things like displaying an anti-discrimination statement in our offices, affirming our positive space commitment to an inclusive and respectful environment, as well as asserting safety as a fundamental human right, thus welcoming, respecting, and supporting two-spirit, lesbian, gay, bisexual, trans, and queer people, as well as their friends and allies. We also included accessible and inclusive washrooms. We modified our workplace violence, harassment, and discrimination policy. We've updated some of our forms to ensure inclusive language, and we encourage staff to use their pronouns whenever it's possible in person and on email.
With the Positive Space Initiative having been in place for almost 2 years, evaluation is an important step in assessing its impact, along with how it has been implemented to ensure continuous quality improvement, in line with the strategic priority of excellence in public health practice. This is both a process and outcome evaluation being conducted in 2 phases. During this current phase, we are examining whether key actions were implemented as intended, and we are measuring their effects on clients and staff. Data collection methods have included auditing intake forms and training records, conducting surveys for clients and staff, completing staff focus groups, and reviewing feedback from the client satisfaction surveys and the staff feedback surveys. Although our analysis is not yet complete, today we are sharing early insights from the process and outcome evaluation, the components of this evaluation. Most staff who responded to the survey feel supported with implementing a positive space. Additional comments related to the facilitators and challenges included dialogue on intersectionality and inclusion for all, training and staff development, and actionable steps that go beyond the statement, and also experiences of discrimination. It is worth mentioning many clients surveyed agreed they were treated in a safe and respectful manner by staff during their most recent public health visit. Additional experiences also included being respected and made to feel normal even if they are trans, and being misgendered and not using pronouns. Initial recommendations for improvement of the positive space efforts include enhancing partnerships and collaborations with US LGBTQIA+ people and service providers, working also on enhancement of positive, inclusive, and safer spaces through public health services in the community, and providing additional staff development, as well as routine training opportunities to ensure positive space efforts are continuously actioned.
Our next steps include evolving a report of the findings from this first part of our evaluation. Recommendations will then inform our second phase. Overall findings and recommendations will help us improve our positive space efforts. We are planning for the collection of sociodemographic data pertaining to gender identity and sexual orientation across program areas. Further, additional staff development and training opportunities are being explored and will be implemented while we continue to monitor client and staff feedback. Over the next year, we'll work together with our partners and people with lived and living experience to explore the assets, needs, and priorities of 2S LGBTQIA+ people in our service area. We will engage in knowledge mobilization of community surveillance data and past research findings. We're very excited to partner with the University of Toronto on a new project, which will explore how intergenerational connections between 2S LGBTQIA+ youth and older adults can strengthen well-being and shape inclusive community programs. This work builds on our previous study and will help public health improve our outreach, build partnerships, and design more responsive, community-informed programs. Thank you very much for the opportunity to share the work of our agency to support members of the 2S LGBTQIA+ community as we continue to strive toward healthier communities for all.
Thank you for the presentation. Is there any questions?
I have one for you, Mr. Chair. Thank you very much. Great presentation. I have just one question. There was one slide there where I think you were referring to a client survey where you said that 88% of the respondents felt they were treated with respect. I think that's what it said. Were there any insights to be gained from the 12% who felt they weren't, or maybe they just declined? I'm just curious about that 12%. Was anything that could be learned from that about potential improvement in that regard?
That question?
Through you, Mr. Chair.
Go ahead.
We are still sifting through all of our findings, and certainly these are early insights. There have been some comments, and so there's a qualitative component to the analyses, and we hope to share more of that in the coming months. Certainly, still grappling. I know Genevieve has been closer to the data than I have.
And sometimes, yes, they were just not any comments shared, and we will be able to share the other additional comments as part of the report.
I mean, don't get me wrong, 88% is a very good result. It's just that I was just wondering some negative feedback that you could learn from. And thank you.
I think our heads are exactly in the same place. 88% is good, but we have a philosophy of continuous improvement here, so we want to try and work together 100%.
Thank you.
Thanks, Bob, for the question. Mike, go ahead.
Thank you, Mr. Chair. Great presentation. Thank you. Some great efforts. Love to see the survey so we can actively solicit information. Just a quick question on both internal for staff and external for the public. Do we have mechanisms that if someone feels or perceive that they are either marginalized or discriminated against, for them to be able to escalate that so that it can come to the attention of leadership?
Through you, Mr.
Okay, go
Chair.
ahead.
Yes, there is. So we do have the client satisfaction surveys that clients, it's available on our website. We have it on the Positive Space website content. It is on that webpage. It's also available when clients do interact with staff that they do the active offer of the surveys also. And the same thing for staff, that we do have a mechanism.
Yeah, absolutely.
Have we received any reports, either from the public or internally, of individuals who may feel, in the context of this presentation, marginalized or discriminated?
Take that one.
To you, Mr. Chair. We reviewed, part of the evaluation was to review the two surveys that we had, like the client satisfaction survey and the staff feedback form. And we don't have anything specific from the Positive Space initiative itself. So we do have the surveys that was part of the evaluation that we received feedback from clients, but not directly from the client satisfaction survey.
That's one clarification.
Yeah, absolutely.
So hypothetically, I'm an employee of public health and I feel marginalized or discriminated against. What am I concerned about within orientation or refresher training? A mechanism for me to say in a way that's respectful, because again, it's how I feel, so I can get the attention of leadership so we can get a resolution.
That's right. Go
Through
ahead.
you, Mr. Chair. Yes, so we do have the staff feedback form that is available for all staff. It can either be done anonymously, or staff are able to provide their names if they want to continue the conversation. So they do have that mechanism either by doing it anonymously on our platform, or like I said, they can provide their names, and conversations can continue.
One more question.
Go right ahead.
Thank you, through the chair. So are members of the leadership group trained to receive a concern or complaint? Sometimes I may not be comfortable going to my direct supervisor, but maybe another avenue for me to approach someone so that these kinds of concerns can be. I'm just trying to understand what we do so that if somebody feels that way, that there's a mechanism, an easy mechanism for them to be able to have a conversation, get some resolution to concern.
Mr. Chair, maybe I'll weigh in here. I think there's a few different avenues here. As Genevieve just talked about, we do have a process for staff providing feedback, either anonymously or with their name attached to it. There's, of course, always the option to go to one supervisor. One may not feel comfortable with that, but if one has a good relationship with the supervisor, they may choose to do that. There's always, of course, the option to file a concern with HR, or if one is a unionized employee, to file a concern through one's collective bargaining group to bring that forward. So there's a few different avenues that one can take.
Thank you. Appreciate it. Thank you.
Any other questions for the presenters?
Can I just add on to what
Yeah,
Dr.
please.
Christie said? I don't know if some of these concerns would come under the umbrella of health and safety, but there's always option.
Thank you. Thank you. Thank you for the great presentation, and look forward to more results and next presentation. Thank you.